Welcome, everybody, to the Home Modification, a foundation for aging in place. We're happy to have you today, and we will be having a very interesting conversation, I am very sure of. I want to begin before we get into the topic that you've all joined us for is acknowledging the land on which Parachute's offices are located. For thousands of years, it's been the traditional territory of the Wendat, the Anishinaabe, the Haudenosaunee, Métis, and the Mississaugas of the Credit First Nation. We are meeting today on a virtual platform, so that gives everyone an opportunity to reflect on the Indigenous lands that you live on and are joining us from. Today, I'm located in Pickering, just east of Toronto, and this land has long been taken care of and sustained by several distinct First Nations, the Huron-Wendat, the Anishinaabe, and the Haudenosaunee as well. So some important information before we get started. This webinar will be recorded, so you are welcome to review it again, share it, or let someone who isn't able to attend know that it will be available, and we'll send out a notice after the webinar when it is available. If you can use the Q&A function to submit questions and the chat function if you need assistance. We have some wonderful people, Michael and Stephanie in the background, that can help you out. And when we end the webinar, there will be an evaluation when you exit. So if you have any feedback, we'd love to hear the evaluation. It will take just a couple of minutes to complete, and it helps us plan future webinars. So without ado, I want to introduce the three amazing panelists that we have joining us today to talk about home modification and what its role is in fall prevention and just making people very comfortable in their own homes for as long as possible. So Marnie Courage is joining us today. She's the founder and CEO of Incluzia Inc. As an occupational therapist, educator, speaker, technical expert in accessible housing, with over 20 years of clinical experience, Marnie is driving change towards equitable and accessible housing in Canada. Her innovative work includes developing the Incluzit Pro and Incluzit Home digital health and home evaluation platforms designed to optimize health and housing outcomes. Marnie is considered a thought leader in accessible housing and home modifications, as her unique perspective comes from the nexus of healthcare and housing and is attracting support in both the aging and health tech sectors. Fenn is our second panelist. Dawn is a pioneering advocate for caregivers and is the president of Caregiver Omnimedia Inc., a King City, Ontario-based company dedicated to empowering caregivers through education, resources, and advocacy. With a career spanning decades, Dawn has been at the forefront of initiatives designed to support families navigating the challenges of caregiving, aging in place, home care, and home modification. Under his leadership, Caregiver Omnimedia has become a trusted name in the caregiving community, known for its innovative programs and commitment to enhancing caregiver well-being. As a caregiver myself, I am very grateful for all of that work. Kaly Ryan is an award-winning industrial designer with over a decade of experience in furniture design and manufacturing. She is passionate about inclusive design and the intersection of design and health. She co-founded Capella Design in 2022, the first lifestyle brand reimagining home mobility, products as beautiful furniture and accessories. In addition to leading Capella's product development, Kaly consults with homeowners, designers, and builders to integrate accessible design principles into residential and commercial spaces. Through her work, she is redefining accessible design by reducing stigma and supporting both physical and emotional well-being at home. So thank you all for joining this conversation today. I am going to get right into the discussions that we are going to have. Let me just stop sharing there. There we go. That we're going to have today, because it is a hot topic, as we can see from the number of people that we have on the webinar and who registered for it. home modification, home design. In those bios, we heard quite a bit of the connection between housing and health. So first off, I'm going to go to each of you and ask, why from your perspective is health and wellness a solution? Why are they not separate? We often think about housing and health as, especially in government departments, they're definitely separate, but they really do play an integrated role in people's lives. So, Marnie, maybe I'll start with you. Why is housing a health and wellness solution?
Yeah, I guess one of the important things to look at is our home is more than shelter. The impacts of the physical environment, the environmental piece of the home, and the social impact really connected to health. So from a physical perspective, the barriers, the fall risks and the accessibility barriers, very tied to health outcomes, as well as we look at sort of those environmental hazards. So if you've got a cold or damp house, it has negative effects on chronic conditions. And then we have that social impact where, if it's not affordable, people are having, or they're located somewhere outside of a city center and have some of that lack of access to services and support, it can be very isolating. So when you look at sort of the physical side of the home, you look at those environmental components and you look at the social components of the home, they all have big impacts on our health and our well-being.
Yeah, and the more you think about it, the more it makes a whole lot of sense. Don, what from your perspective, in the decades of work that you've done in home modification, supporting those who want to age at home, which we all do, why do you see this as an two integrated sectors?
Well, lots of overlap between housing, healthcare policy, and the lived experience. So you take all of that and you look underneath that and say, well, what are the sectors that are involved? And they become very, very much like healthcare. In other words, aging in place is there. It's a huge market. So is health a big market. And health looks after functional needs. We need practical and design issues that surround the home. There's funding in home modification, like there's funding in healthcare, and there's policy, and there's excess, and how do we do that? Certainly, one of the big things that I'm champion of right now is collaboration among sectors, and while there is collaboration between healthcare, it's not good enough, and we need to do a lot to strengthen that. But equity and inclusion, which is Marnie's specialty in a lot of ways, she's mentioned the rural versus the urban, the cultural issues that surround healthcare and housing are equal. Technology and innovation is all something that we're both looking at closely in housing and in healthcare, particularly in housing lately because of the challenges that they have, and the lived experience and the adoption uh, of helping to make seniors to make their decisions from healthcare and things. I think when you frame housing as part of healthcare, home mods and aging in place become preventative medicine.
Yeah, and as a caregiver, it becomes very quickly apparent that the housing or the home environment, or, when a parent is in hospital and the questions, especially, senior parent, the questions that they have for you are what are they going back to? When they're discharged, what does their home environment look like? And so, it might be a little less obvious, but when you shine a light on it from the healthcare people sector, they're already integrating those components into their discharge. plans and things like that. Kaly, when you think about, you talked about health and housing being intricately linked, and obviously the design that you and the approach that you take is very different from some of the things we've heard from Marnie and Dawn. When you think about health and wellness, how does housing play a role from your experience and perspective?
So I think, and really, I don't have that much to add to what Marnie and and Don have said. They've said it so well, but I think the way that I think about kind of this connection between housing and health is also related to medical models of health and disability versus social models of health and disability. So a medical model would say that what's going on, the limitations that are happening in your life are based on your body, whereas a social model understands that it's actually our entire environment that is integrated into our health. So it's not, say, needing to use a mobility aid that's stopping you from maybe having that independence. It's that your home isn't set up for you to use that mobility aid. So really switching the conversation from something that's centered towards what our bodies are doing and towards what our environments are providing for us is an important way to shift this conversation. And I think also to address some of the stigma around making these accessibility changes as we grow older.
Yeah, and working from a point of, what are the assets that somebody has and the environment has versus what isn't working, I guess, as well. Um, Marnie, maybe we could talk a little bit about, so when you go into a home to assess, because that's the first thing we have to know, what are the abilities, what does the home environment look like before we can identify what the potential solutions are. What do an occupational therapist, we've heard quite a bit that, a lot of people, especially in the public, don't know what an occupational therapist is or does. And I've decided that occupational therapists are my best friend since I've become a caregiver. So tell us a little bit about, what do you look for when you go into an environment and assess a person and their home or wherever they're living, to make it more livable for them.
Yeah, thanks. I think, something to know about occupational therapists are we use a whole person approach. So we are looking at the full person. We're not just looking at mobility. People think, oh, you go in and you assess somebody's mobility. But occupational therapists, the role of OTs is to help people achieve the goals they want to achieve with their current abilities and to be able to optimize their performance in the activities of daily living, whatever those happen to be. So every assessment is different. There is no formula for this assessment. And we've tried and made all kinds of different devices and templates for this. But the reality is every individual has unique needs and they're in a home that has unique set of conditions and they've got a support system that is unique to them. And so really what we look at when I say we've got a whole person approach is we're looking at the person's physical capabilities, we're looking at their cognitive capabilities, but we're also looking at their psycho-emotional status, what supports they have in place. And so as it relates to falls, the first thing we're doing is really looking at fall history. Fall history really tells us a lot about their risk for ongoing falls. And one of the things we talk about a lot is about fear of falling. So we sort of try and rate their fear of falling because your fear regarding falling actually changes your behavior and how you stand and how apprehensive you are, and sometimes can reduce your natural mechanisms to adjust to being balance being set off or things like that. So we look at a lot of that, but then we do a comprehensive mobility assessment and functional assessments. How people transfer from sitting to standing is a really good indicator of sort of their fall risk and how they are going to manage in the home. So there's lots of standardized testing that we use. Something called a timed get up and go gives us a lot of information about somebody's mobility and their transferring. Then we look at safety and judgment, and that's cognitive. So what do people perceive are safety risks? A lot of people, we go to do a home assessment, a lot of people will say, I'm fine. I don't need anything. I've been managing quite well. But, we put on our detective hat and we look around the home and we spot a bunch of risks maybe that they didn't know about. And sometimes they know about the risks, but it's things that they like and don't want to change. So not only are we just identifying these risks that feel like checklists to other people, we're also looking at what is their current abilities and future needs while we're looking at the risk factors in the environment. What about their medical condition puts them more at risk of falling? And then we're putting all of that together in a way with the homeowner or with the client to really talk about what are your goals? Instead of me spewing a bunch of shoulds and saying, well, this is what you should do. You should change this. You should change that. It's what are your goals? Do you intend to stay in this home? And what do you want to preserve? I talk about that a lot because we tend to talk about home modifications of all the things that somebody needs to change to be safe and have an accessible home. But equally important is what do people want? What's valuable to them in their home? What do they want to preserve? Is the aesthetic? Is it their dining room table, the way it's set up because their family comes together on Sunday dinners? Because they have bridge club at their house. They don't want to change this certain room. Whatever it is, it's really important that we collect all of that. So I would say, you asked an easy question and I give you sort of a complicated answer because every assessment's different. We look at the whole picture. We look at somebody's risk factor from where they're located, what their innate fall risks are, what their environmental fall risks are. We look at accessibility from what do you need now and what might you need. We call it future-proofing your house. And the earlier you start planning to do that, the better, because nobody should be planning in crisis. Because one, it gets pretty expensive to have to make really quick decisions fast without a thoughtful idea about how we could progress change over time. And really looking at what funding is available. It gets very complex. So I'll leave it there, but I hope that gives a bit of a lens on what an OT might be looking at when they're in the home.
Yeah, thanks. It does, and it really I think expands a lot of our understanding on what aspects you're looking to assess. That it's not just the physical ability. And I think putting the person, and we've heard more and more talk about this over time around putting the person at the center. What do they want? What are their goals? And they will change depending on the person. And Kaylee, you must run into this a lot because one of the, and we'll talk about barriers a bit later, but as Marnie, you were talking about they like that dining room table because that's where their Sunday dinners are, but it's also they don't want to look frail or there's a stigma attached to the potential assistive devices. And I think Kaylee, we'll get into a bit more later, but talking about, the aesthetics, finances is one thing, but the aesthetics too, you think that's sort of well, who cares what it looks like, but that can be a big issue. And Kaylee, your work around making those devices either invisible but useful or designed so well that it just looks like other decor, I think is important aspect. So we've talked a lot about home modifications, as a big umbrella category. There's a lot of different types of home modifications that can be done. So Don, maybe I'll start with you around, you know, what are home modifications? And in your experience, what's the range that could be done in a home to make it such that somebody can stay longer, living longer in their own home?
Well, it's a how long is a piece of string question because it again depends on that OT assessment. It depends on, whether the person has just had a knee operation or a new hip versus a long-term disease, disability, or health condition. I guess I can sum it up easily by a question that was answered at a summit we had in Halifax, and the owner of the local home hardware was in the audience. And when we were talking about the cost of home modifications, he said, you know, when we go in to do a home modifications, it's amazing how much a homeowner does not understand their needs. So, but when they start questioning from a construction viewpoint or from a design planning viewpoint, it can range to from $5,000 to $6,000 to let's build a new house. You need it.
Right, because you could look at, grab bars as a good example of a maybe lower cost kind of modification to a home to a full, primary suite on the main floor kind of reno, I guess, and everything in between. Kaly, from, when you look at, the range of modifications or the accessibility of when you're designing products, what kind of modifications and accessible issues have you come across?
Yeah, so I think like home modifications range from like I would even consider rolling up your rug, which is a free activity, a home modification, to like, a multi-million dollar brand new giant build. It's and everything in between. So you kind of have to take in a lot of different factors when you're figuring out what's the right products, what's the right design process to go through for your space. But I think, in terms of the most important thing is really understanding what you need as whether that's talking about caregivers and users and families. And Marnie really said this very well in talking about OT assessments, which is why OTs are such a fantastic resource. Is they come in and say, how are you actually using your space? Because if I design a grab bar that you can't actually use or install because it's not, maybe it doesn't work with normal stud configuration. We see this in some grab bar design. Or it really doesn't work with the flow of your space and you just cannot look at it, which is a stigma thing, which we'll talk about in a bit, I'm sure. But then it's rendered not useful at all. So understanding those multiple viewpoints and understanding the user when we're designing and specifying products is so important to actually getting them installed at all, installed properly, and then used. And so, kind of coming back to there's this huge range. We're talking about grab bars, rolling up rugs to like brand new builds, bathrooms, and everything in between. And I think there's really also a lot of opportunity to start in this small space so you can ease into these bigger decisions as you go.
Yeah. Yeah, and Marnie, I guess you've probably seen the range of home modifications that could be made. And you would you go back after the home, like if you've met with a client, with a family, and sort of made recommendations, they've gone ahead and done that, and then would you go back and reassess?
Yeah, good question. I would love to reassess because those are outcome measures. If we just do the assessment, make recommendations, and are not either funded to go back or asked to go back, we actually don't have a way to measure what was the impact of those changes we recommended. Also, were those recommendations actually implemented? So that's actually one of the gaps in home modifications happening today is we lack statistics on the impacts of the recommendations because we're often not called back. So it depends who the funder is of the service. So if it's the provincial healthcare systems, often, yeah, so the OT would go back to see how the changes were made, but typically the funding for the for the actual equipment or modifications is the homeowner's responsibility. So that would depend on whether or not they could afford or want to purchase those items that we've recommended. I would say also that when we talk about home modifications, we should be clear about these are not just renovations. These are not just upgrading your bathroom and your kitchen. This is about actually making changes that have an impact on function, and they're specifically for people with disabilities and older adults. So when we're using language about home modification programs, these aren't just renovation programs to increase the aesthetics and bring your kitchen up to date. However, they are correlated, because if you were thinking about updating your kitchen or bathroom, it is a great time to be thinking about aging in place home modifications. The other thing about modifications and new builds is there's a pretty clear line in the guidelines and standards now, but modifications are changes to any existing dwelling, whether it be a single family home or a multi-unit dwelling. They're changes to the existing dwelling. It could be an addition, but it's typically within the existing structure, whereas a new build is a new build, and that's considered accessible housing. And there's different building permits and construction code and things that go with that. The one thing that's uniting new builds and home modifications, however, is a new standard. It's not that new anymore, but it might be new to you, which is called B652 Accessible Dwellings. And that's finally a document that's being adopted that really looks at all the shoulds. What are the technical specifications for which home modification should be done? So when we do get the chance to go back as an occupational therapist, we now have a standard for what items need to be improved and what are the impact of those recommendations. So if I ever get to go back, that is what I'm measuring, is the impact. One, what was actually put into place? Two, what was the impact of that? Are people able to now participate more fully in their activities of daily living or whatever it is they want to do? Or are they getting out of the house? Are their caregivers now able to come in because it is set up better for them? That's what really matters. And that's where we need to go to the federal government in terms of those impacts, to show what are the impacts of home modifications, because we know we're keeping people out of the hospital. We know we're preventing premature admission to long-term care facilities. We know we're reducing caregiver burden, and it goes on and on. So yes, if we get to go back, we love to go back.
Yeah. Yeah. Thanks, Marnie. Stephanie's put the link to that standard in the chat so people can grab that if they want. Don, you brought up an interesting aspect, and sometimes it kind of maybe is a precursor to a full home modification, but you talked about, maybe temporary modifications that might be needed because of a surgery like a knee replacement or a hip replacement. Um, and one of the challenges, I mean, we've been talking about this for ages, is access to credible services and products that can modify the home. Can you talk a little bit about some of the work that you've done, with the adaptive program, the training program that many people may not know about?
Yeah, I can. I first will preface that our company is a private consumer based marketing and media company. So everything we do pretty well with substantive research. And back in 2021, we with the March of Dimes Canada commissioned a national survey on home modifications and aging in place. And we did it because their own funding, which is the March of Dimes in Ontario, was the largest funder of home modifications. We basically said, let's take a look at, first of all, the handicap market, but let's also look um, uh, at the general population, and then particularly let's look at those over the age of 65 and 85. So that was the first time a research company had ever had a demographic target like that ever proposed to them in a national survey. So that survey showed and surprised everybody, including ourselves. But we knew a lot of what of this was happening. So we had 57% of all Canadians aged 18 to 85 were living with a disease, a disability, or a health condition. So that kind of research led us to uh, uh, broaden our base of exploration, if you will, into home modifications. And so we have that research available now. And if you'll let me know if anybody wants it, just email me and we'll send you a copy. It's quite extensive and it's updated every year.
Yeah, and that really showed, the potential number of seniors that, want to make home modifications. I think it was, in the 99%, range, right, of seniors who wanted to make no home modifications because, as I often say, nobody, drafts their retirement plan and says, I want to move into a long-term care facility. If you need it, that's fine, but most people want to live in their own home. So, what does that, and we've talked about this, what does that translate to into the potential spend that's out there, this market that construction, renovators, designers, all of those folks potentially have to access to actually make the home modifications? What does that look like in terms of the dollars that could be spent?
Well, that became the biggest surprise of the survey, and we since the survey was done in 2021, we have updated it every year. Back then, there were 11 million Canadians that were going to modify their home or plan to modify their home in the next 5 years, and they were going to spend about $87 million. So that would, in today's figures, has gone, the 11 million has stayed pretty well standard and the same, but the cost and spend is up to $100 million. So we're actually, home modification is a larger market than the actual renovation market in Canada. So it's an interesting surprise and statistics that unfortunately a lot of people don't know about and don't take advantage of as this market just burgeons.
Yeah. Well, from the pop-ups that I'm seeing, there's a ton of people who want the link to that survey results, so we can send it out to all of the participants. We'll get the right link from you, Dawn. Before I move on, just quickly, the can you talk about a little bit about the adaptive, and that's adaptive with a V, from that you worked on. I think Marnie, you may have worked on it as well, but that training that is available to the folks who uh,
Anybody.
seniors and their yeah anybody but seniors and their families would be going to, they're always looking for credible people to have those do the design, the renovation, provide them with a product.
Yeah, it's a challenge, just like healthcare has its challenges. The housing side has its challenge, and one of those is in the renovation market, where there is a lot of fraud. There's a lot of people that have promised and said that they know how to modify a home, and have gone in, and then subsequently 6 months later, they've had to go in and redo it with some other people that have been properly trained. So it's a big problem, but the Canadian Home Builders Association is, along with us, including Marnie and myself and others who put together a training manual for adapting the home. And we have about 280 people that have taken that course. It really got launched a year ago. And about 100 of those are in Ontario, and more are going through it every year. But it's an $85, or sorry, the cost of the course is just a little under $1,000, a little less for people who are members of Canadian Home Builders Association. And a lot of OTs have taken that. We're pleased to see. But with 60,000 contractor renovators in the country, we've got a long way to go.
Mhm. So this is for renovators, contractors, OTs can take it. Other.
Designers, it's open to and has chapters that kind of relate to that ability to collaborate, because when they get into the actual course and the manual, then you'll see all the touch points that come into a home modification.
Mm, great, that's great, and we can send out the link to that training as well. Kaylee, I want to switch gears a little bit, and because I'm fascinated with the design process. And one of the reasons why we had you on today, I thought it was a great compliment to both Marnie and Dawn's expertise and experiences. I'm interested in how do you even start? Like when you looked at, the grab bars, I know you have a beautiful one that's got a picture frame on it with the grab bar underneath. It's put on like a landing or on the stairs or on the hallway or things like that. But how do you even begin when you're thinking about designing a product that will help accessibility?
So for us, the most important thing is to start with the actual user. So that we use a process called co-design. So we work with older adults, people with disabilities, caregivers, and experts in figuring out what the actual problems are that we need to be solving. So in the case of our the grab bar that we make, it essentially looks like a picture frame, and from underneath it comes a grab bar. A large issue we see is that grab bars, people don't like to install them in places like hallways, landings, because it's kind of in the middle of your house, in an entranceway. And so there's a lot of stigma, but there's also just, it doesn't make sense in the space. And so did a lot of research, worked with some focus groups, did a lot of back and forth in kind of the design and iteration to create something that would really work for these other awkward spaces where we need a little extra support. But really, and this applies to any process, whether we're talking about OTs, general home modifications, working with the designer, this idea of really bringing the actual users and their supporters into this process early on is key to success. So I would say to the people watching, if you are thinking about doing these types of modifications, you really, when you're talking to people, whether it's, your contractor or a specialist, an expert, even if it's someone like me who, I do a lot of consulting for folks who want to put products in their space and aren't sure how it's going to work. You want to make sure that they're asking you questions about how you actually use the space. And the other thing I would say is you should expect a little bit of back and forth. I haven't in terms of, we have so much stigma around aging, that people, even if you're here and you're like, I know I need to make changes, it still can be difficult to accept maybe the breadth of changes that are suggested. And so someone who really has your health and your best interest in mind might challenge you a little about how you can do things and where you can put things. And someone that will work really well with you will be able to not only kind of like bring that health knowledge and that into the fold, but also listen to your real concerns. And that's really what co-design is about, which I think kind of is at the heart of every good product that's made, really.
Right. And with co-design, do you use a particular program or is it just that process of co-designing with the?
So co-design is more of a process. I've seen more specific, like a massive company will have a specific way that they approach it. For us, it's kind of depends on the product but we'll expect to be like, for example, making that grab bar, right? We send it out, we get feedback, we have users. This is Marnie's dream, is to actually see things get used and then come back and get the results and make changes and go back and forth. So it's about actually, people actually experiencing whatever it is that you're assisting with as you're building it. So there, instead of designing for them, you're designing with them.
Yeah, and that's very much in line, Marnie, with how your process starts, putting the person first, asking them what their goals are, because your goals may be different than theirs, and their experience with those particular. I've often used a product and thought, I wish I could give the product designer or manufacturer some feedback, because if they'd only done this tweak, it would have been great. So it's great to hear that that's the type of design. I think more people. There's obviously the standards that Marnie talked about, and there's standards for different products. So you need to meet those standards, obviously, but there's some, range of how you can execute those, correct?
I will say, not to interrupt, but I will say on standards, just as someone who's done a lot of product sourcing and getting into the standards now that I do more consulting, standards we generally refer to as the floor, not the ceiling. So we actually have some fantastic, the standards that Marnie shared are a great improvement on where we started in something like code, but we're still, because it takes a while for us to agree on what a standard is, it's for, the most amount of people possible. It's kind of actually getting someone involved, talking about your day to day will be an important extra layer beyond those standards.
That's a really good point, is that those should be the minimum for sure. There's been a couple of questions around, funding, and I'll go to the, our next kind of area of conversation is about the cost. And Dawn, you touched on that earlier about, it could be from a few $100s to, you know, at the length of a string, many millions of dollars, depending on what you need to do. There are some national, provincial, and territorial funding sources. We have a Word document that Claire has put in the chat if anybody is looking for that. But cost is a significant barrier to people who are looking to make those modifications. And I would say the other piece is, the cost in and of itself, but then there's um, the benefits in terms of, the cost is to the homeowner or the person who is making those changes, but the benefit is seen in the healthcare system. I mean, obviously our taxes are, part of that. But that's one of the challenges that we've seen, Parachute has seen in injury prevention is often the injury costs are in one sector and the benefits are in another sector. And so I think where we started to talk about, housing and health and this collaboration, as you said, Dawn, and the intersectoral nature of this issue really needs to be recognized because the individual may not they may see the cost, being incurred by themselves, but where are the benefits happening? And sometimes that's at a different level, at a societal level. So I think the question about costs, I think it can be whatever, depending on what it is and what your certain situation is. So let's talk a bit about some of the barriers that you've seen for people making home modifications. Marnie, you're sort of right on the ground with the families and the individuals. We talk cost a little bit. There's stigma. There's the what it actually looks like. Can you talk a bit about what you've experienced in terms of the barriers that people have to make home modifications?
For sure. Thinking even about personal experience, I'm an occupational therapist, and between my husband and I, we have six parents. I have mentioned many times to my parents things that would improve the ease of bathing for them, different kinds of modifications that would just make their activities of daily living easier, definitely ones that would prevent falls. And do you think they have implemented 100% of my recommendations? No, I'm talking maybe 2%. So we have to look at human behavior, right? It's not just knowing the information. It's like that used to be with quitting smoking, that the information wasn't enough to change behavior. So what changes behavior? There's some psychology around it, but one is that there's that people wait for a crisis. They think, not me, not yet. I had a young older gentleman who was 92 years old, and I did a bathing assessment with him. And it was a shower, and I said, some people find that a vertical grab bar here as you step in can really help, especially when the floor is wet and those kinds of things. And he said, thank you, dear, maybe when I'm older. So that's what we're dealing with in terms of knowing the information isn't enough. So people tend to wait until there's a crisis. And what's the most common crisis? A fall. So people wait until there's an incident, and then often there is an injury and there's hospitalization. And then there's this giant emotional situation that a whole family gets involved in, where it's what's going to happen to mom? Where is she going to go when she leaves the hospital? So I'd say the first barrier is people waiting until there's a crisis and not doing the planning that we could do. And we're all in this, right? We're all planning for our own aging. I'm more focused on my parents than I am on me, but I, in my 50s, need to be thinking about me and my family and my planning. So it's backing it up a bit down the river from reaction to prevention. I would say fragmented information that's available to people that they trust. That's another barrier. So people getting information, a great webinar like this is a perfect way to gain information. People reading about information, talking to their friends. So there's some of that fragmentation about, or what are they trying to sell me? What's happening here? And so not trusting some of the information about home modifications and the return on investment. People want to know, am I going to get that money back if I do sell my house? What are the ones that I should do now and what should I wait for? A lot of miscommunication and misrepresentation about that information online. And then I would say another barrier is actually access to professionals. So access to occupational therapists in your region, access to qualified renovation specialists. And again, Don had mentioned the adaptive home course is put on by CHBA. And so you would go to their site, and Pam, I think you were going to send out the link to that. But building professional capacity, we're trying to build professional capacity for occupational therapists across Canada. But we know that rural communities has less access to occupational therapy assessments, and even more so on some of the First Nation communities. And so we're looking at this inequity of access to just first identifying what people need. And then you're talking about lack of supports. That's probably one of the biggest barriers is we know that there are home modification funding programs starting up in different provinces, but they are siloed and they do differ in terms of eligibility. Some have an OT assessment link with them, most don't. Some are capped at certain amounts of money that don't allow people to make the changes that they actually need now. It's future planning. We don't want to plan until we have to. So it's really focused on what can we do better in Canada here from a funding perspective, and having a national home modification program like they do in the UK, like they do in Australia. So we're looking at this when we talk about collaboration, and Dawn talked about it, and having various stakeholders come together, and more advocacy needs to happen and more policy needs to change to get a national home modification program in place that has very clear eligibility criteria, that really mandates an occupational therapy assessment, and that does that follow-up assessment to measure the impact. Because we are seeing cost studies come out, and there are more cost studies. We also have more studies coming out about the impact of having an OT assessment. So there's more evidence coming out there. We have the evidence. It's now going to government again and again to say we need this preventative program to help mitigate some of the costs to the healthcare system and to keep people healthier.
Yeah, absolutely. Dawn, this rings true. We've been talking about this for a long time, but and prevention is always the secondary to reaction, like in choices. But from the barrier perspective and the question about seniors, I think in the survey that that you've done, and obviously from all the conversations that you have, one of the things is that seniors or individuals don't think they can modify their homes. Am I right in that? Sorry, Don,
Is
did you hear the
is
question?
that for me?
Yeah. From
Yeah.
that we have to even start with like education or knowledge of that this is even a possibility.
Yeah, no, I think I happen to be pushing 82 this year. So, I've been around a lot of my own peers where it's more the fear of the unknown is there when you get into an older age. And the reality is around 70, you start to feel physically that there are challenges, and probably there's some data out there that somebody has. I'm just speaking from experience with all my peers. We start to frame ourselves in a little different way and start to exercise and all the rest of it. But by the time you get to 80, it's you have to do something, but there is just this fear of the unknown. That's where I think it's so beneficial to have an OT assessment, because in our age group, we we listen to our doctors. We don't challenge them. They're respected for their academic degrees and their experience. And I don't think that that's sort of happening as much as it should happen. But the having an OT and the information that they garner is really gives you a lot of confidence to therefore deal with the construction side of it and start to do it. But I think, and I've said this to Marnie many times and other OTs, that I think the most important thing a government can do is pay for that assessment. It's not that expensive, and it really makes a profession out of home modification, and it knows that we adhere to standards, we do this, we do that. So
Mhm. Can you talk a little bit about the stigma aspect as well? I mean, as professionally and personally, I think we've all had some of this experience, but the stigma of, well, if I need this, I think that's one of the conversations we've been having is some of these things need to be in homes, like regardless of age, like grab bars. Everybody has the potential to fall in a bathroom. It's slippery, it's hard surfaces. If you wear glasses, you take them off, your eyesight is compromised. Like, I know, it doesn't matter what age you are. But there's this stigma that it's the negative side, like if I need this, I'm less than, versus here are my goals, and if I get these things, I can actually reach those goals. Can you talk a little bit about the stigma conversations that you've had over the years?
yeah, I think you have to understand that initially, from a the physical uh, disability people, which really started home modifications because they were in a wheelchair and they couldn't get into their home. It was that simple. So there was a stigma there that kind of still follows along with the modification. Um, but I say to everybody that I think I've learned over the 20 years we've been doing this is that the home modification is a uh, needs market, not a wants market. So it may be that my wife wants a new kitchen, but she's not going to get it because we don't need a new kitchen. But when she has a hip replacement, we need to have things done so I can get her back from the hospital and get her rehabbed in the home. So that's kind of where I'm at on that one.
Mhm. Yeah. Kaylee, what from your perspective in terms of barriers? I mean, aesthetics obviously would be part of that. And we've seen, I think there's a real opportunity for those working in the design and manufacturing realm to make these products and tools pretty and available in
Yeah.
different finishes, all that kind of stuff.
Yes. And I mean, it is a need situation, but when we have that need come up, there should be choices. Getting the clinical hospital grab bar should not be the only option when you're faced with needing a grab bar. And this is something that it's a slow change, but we're trying to be at the forefront of it in terms of finding and creating objects that are beautiful in order to reduce that stigma. So we actually have a catalog of hundreds of products. We don't have them all online, but that we've kind of curated and give people as options when they're looking for these types of things, because we need something that actually works for our lives, or we're going to not install it not install it properly or not use it. Um, and I would say, yeah, stigma and aesthetics are actually a huge factor. Obviously, we're going to talk a lot about budget in this space and about supports, which is definitely a separate factor as well. But actually having the options that work in our spaces and the importance of how these make us feel is really key in creating, successful spaces where people feel empowered by their homes. And just one thing to add to the conversation about stigma, which actually someone addressed in the chat, but I was thinking about before, is that a way to reframe that often works well when we're talking about people preparing is visitability. So people we love come and stay with us, come over. They're often older than us. They have different needs than us. And so to make sure that they can get in your house and use the washroom are key. And then that's going to help you in the future as well. So being able to kind of use that as a way to get, to reframe how we're working on some of these projects for ourselves can be a big benefit.
Yeah, I agree. I have like my mom can't visit my house. Was built in the late 1800s. It does not it is not accessible. So there's I guess the last question that I'll broach, and then we have some questions online that I'll get to as well. Is how do we increase the number of people who know about home modifications, are making good home modification, ones that they need. But and in particular, I think we've talked a lot about people who are in their own homes or have the ability to make the changes in their own homes. There are a whole lot of people that are living, and it's come up in the chat as well. New builds are an opportunity to integrate some of these accessible aspects, wider door frames, lighting, grab bars, those types of things. But there are the majority of people are living in already built home environments, and a lot of them are living in places where they may not have control. So they are living in rental units or condos that have particular restrictions on what changes that can be made internally. What do you see? Like what do we need to do from your perspective, just as a summary, to increase the number of seniors who are able to make these changes? And Don, maybe I'll start with you.
Yeah, I've got one that's a little available for everybody right across the country that we're starting to put into markets here in Ontario, and it's basically using the Ontario long-term care model as basically it's financially on its unsustainable without shifting the care to the home. So let's start there because then it says, well, how do we shift to the home? And you take it there, you can go a lot of different directions. You can bring in a lot of people. I use this an example we did in Barrie, Ontario, just north of Toronto, where we looked at a local long-term care demand because we have a wait list in Ontario of close to 70,000 people waiting for long-term care. So I looked at Barrie and we said, you have 541 beds in your 4 locations that house long-term care. So in one location, I found that they had 126 beds and their waiting list was 668 people. I looked at one other location, which is locally owned by the municipality. They have 160 beds and they have a waiting list of 658 people. So under construction in Barrie, they had some approved beds for 346 new beds over 6 to 8 years. So when you do that math, you can see how important home modification is to keep those people out of long-term care and the expensive long-term care. So even though we're talking about an expense uh, that is growing in home modification and aging in place, the long-term care costs of are $100,000 per person per year. So
Right.
that resonates with people about the education portion, getting together with all the collaborators in your local community, And we put on a conference there last year, and that moved people to go and take the course and do other things. So that's what we need more of. And so if anybody across Canada is interested in having us all out there to put on a conference, just we know how to do that very well.
Yeah, yeah, and I think yeah, the municipal, I mean it's various levels of government that have different jurisdictions, but at the municipal level that makes a lot of dollars and cents to them. Marnie, what any thoughts on how we make how we increase the number of people who are getting what they need to stay at home?
Yeah, I guess, I've made that sort of my work of the last 10 years, a real focus. And what I've done is developed a platform that'll be coming out in the spring, but it's bringing people together at a free platform to understand their own readiness. Because I think that readiness, people don't know if they're ready for aging in place or what they need to get in place. So one of the things I look at is it's more than just home modifications. It's about your financial and legal readiness, your access to transportation. It's about your connectivity to your community. It's about your own technology capabilities and whether or not your community has Wi-Fi. So I've put that together in a platform and then have a national directory of service providers. So we're going to be actually linking people to occupational therapists, linking people to qualified renovators, linking people to designers and other folks that can help them out through this platform. So I've kind of, taken all of these discussions over the last 10 years and said, let's put this together and make it free for the consumer. But ultimately, it depends on more funding at the provincial level for health and not putting our dollars into building more personal care homes, because that's currently what's happening. We're seeing more long-term care homes going up, and we're seeing less dollars, or we're not seeing the dollars we need being putting into our existing housing stock. So it's got to be sort of this flywheel scenario where we've got more support for assessments and more support for solutions, and we need the consumers to know where to find it all.
Great. Kaylee?
Yeah, so I agree. I think, there's been some talk in the chat about fragmentation, obviously, with every province being different. But at that provincial level, we need the funding to be able to modify what exists. I would say just because I think everyone wants something small that they can do right now is working on this. We can work on this cultural shift from the stigma around changing our homes and how that feels, and also trying to move into the understanding that we can start with little things right away. So actually, and I'm sure you'll share this later, but on the front page of our website, we have a list of kind of things you could do. You can sign up and you can get a list of 10 things you can do right away to quickly modify your home to create a little more accessibility in your space. And then, you can kind of move from there. But I think we have this big idea that this is a big thing that's going to cost a ton of money, and we're not sure how to do it. We're not sure. We don't feel like we trust, our contractors, like, or someone to just, and to be fair, there are folks out there that will say that they're doing accessible work and it won't end up being accessible. So that is concerning. I'm really excited for what Marnie's building in that regard. But being able to start with ourselves, even if you're younger and you're just thinking about, like, man, I'd really like a nightlight when I walk through the hall at night. Well, if you're putting that in your home, it makes it easier for the older adults in your lives to see that that's a totally normal thing and not something that's stigmatized. Would be my kind of small piece right there. Yeah.
That is a very good point. There are things that you can do immediately that are no cost or low cost, and leading by example, role model, and we have to start thinking about it now for sure. I'm going to turn to some of the questions that are in the Q&A, and Marnie, the first one I think is an interesting one. Can OT assessments be done virtually, given rural areas that have a lack of OTs? Or are there other ideas of how those rural or those communities that need that service where they don't get them can be served more equitably?
Yeah, that's a great question. Certainly looking at access to an occupational therapist, we're looking at all of these mitigation opportunities. For one, I would say that the occupational therapists need to be regulated in their existing province to do in-person, but each province has its own rules about whether or not occupational therapists need to be regulated in their province to even perform virtual. So there's some provinces that say, I think, and I don't want to misspeak, but I think it might be BC and a few in the West who say you need to, even if you live in Ontario as an OT and you want to provide virtual services, you need to be registered as an OT. So there's costs that come to the professionals with that. So yes, can it be done? Yes. Are there still barriers? Yes, there's still barriers. I would say there's some prerequisites to doing a virtual assessment. One, the person on the other end needs to have access to Wi-Fi, needs to have a mobile device to walk around the house, or have a partner or a support person who's going to be able to show the relevant information. Do we get all the information we can over virtually? It's not the same as in person for sure when there's human to human connection, but it is a close second. So yes, we are looking at, and it does happen all the time, that virtual assessments can occur, but they're sort of second in quality to having an in-person. And then the third step is just having a consultation with an OT to start even talking through a telephone conversation
Okay.
about what particular needs somebody has, what their current medical situation is. So there, we will see more virtual assessments happening. Funders also have to be okay with it. So there is a certain security and web security issues that come up with it, as you can imagine. So yes, it's happening. Are there barriers to it? Yes, but it's a good sort of second choice to an in-person.
Okay. There's another question about, how do you get people to think about preparing before a fall, that theme of upstream. I think there's a number of resources that all of us have, and we'll send out links to each of your organizations in the follow-up recording. But Parachute just launched a Caregiver's Guide to Fall Prevention. That can be used by anybody, but it takes exactly this approach of, here are some things you need to think about beforehand. Here are how you can prevent falls, and then some tips on, what to do if you fall, how to get up safely, how to deal with somebody who has fallen so that you don't injure yourself as well. And that's available in online, but we are launching an audio version of it very shortly. Some iHeartRadio podcast site has it, but it's not fully launched in French and English. So just to add that. Um, Don, there's a question about how do you empower older adults to report falls to their physician care providers when they're scared to report for fear of losing independence? You have a hesitation to report that there's a fall or a near fall even, because that may really severely limit your independence. And do you have any tips on or
Uh, yeah, lots of personal ones, but
that's
because
good.
because of the age. Um, but boy, that's a tough question. I don't know that I really have the qualifications to answer that. I think you might have to talk to the physicians about why they don't take more interest in all of this, as a matter of fact, because they don't get paid for it, is the answer to that. So, uh, but if more physicians were educated on home modification and aging in place, I think we would work with them to find an answer to this.
Yeah, the guide that we just launched has some tips on how for you to have a conversation with your family member. But it's the fear of reporting falls to their physicians. It's like, am I going to get my driver's license taken away, or things like that. Those are, I think, uh, uh, some of the concerns. So I think what you're saying is, physicians and healthcare providers need to have an approach that welcomes that and has, I think, Marnie and Kaylee, your co-design approach of not, knee jerk. Okay, oh, you've fallen. We need to do this. But, what would the circumstances around that? What could there possibly be so that, put into place. So it's and physicians don't have a lot of time either. So I can see why they would just, a knee-jerk reaction have that, oh, what do we need to do? You need to stop doing this in particular, whatever you were doing, and, don't go out or don't do this. So I think there's a lot of education, both on the professional side as well as the public side, about why identifying these, I'll make an analogy to the concussion conversations that we've had, which does have a link to Falls. But the sports, the athletes don't want to say if they think they have a concussion. Number one, their cognitive may be impaired to actually say something, but they don't want to say anything because they fear getting pulled out of the game. And so having this culture shift around, no, the sooner you tell somebody, the faster we can address it and get you back into the game. And I think that's a similar approach that maybe needs to be taken here. The sooner we can identify this, we can have some supports in place that can prevent anything more serious from happening. But it is a bit of a minefield of potential conversations that go bad for sure. There's some conversation or questions about the visitability of homes, and adjusting the building code to make homes um, more visitable. And Kaylee, you mentioned that people getting into the home itself is a challenge. I'll just put this out to any of you. Have you been involved with any of the building code discussions? I know Nancy Edwards is online, so I see her making comments. Thank you, Nancy. She's probably the closest one to some of the building codes. But any thoughts on the challenge of changing the building code? Maybe that's the question.
So I work, I mean, because I focus more on the product side of this conversation and how that fits in, but I work with folks who are more kind of on the upstream talking about building codes, working on committees, and it takes a long time to get something put into building codes. So folks have advocated for grab bars in building code. New builds must have grab bars, but that that can take a long time to actually get to where we're actually seeing that. And obviously it only really applies to new builds, generally mostly to commercial builds, depending on a lot of this. Like, it's all provincial, so it's very siloed. So some provinces are maybe more proactive on accessibility, whereas some aren't. And really, as we discussed earlier, building codes, because they're kind of the lowest common denominator. We're doing some great work in Canada with Accessible Standards Canada, but that's not building code. So for us, it's being able to actually assess, if you're looking at your own home to modify it, what are the actual needs, because they're often quite different than what they're trying to do with building codes, which is make it the most usable to absolutely everyone, which sometimes isn't the best case, for depending on your space and how you're living. Like, we can't all put a giant bathroom in our homes.
Right. No, you're right.
Yeah.
Don or Marty, do you have a final comment? And then I will, time flew by, but go ahead,
Yeah, I
Marty.
just want to add some hopeful code information too. And so the next cycle for code is in 2030. And this is the first time we actually have an accessibility committee advising for the code committee. And there is an occupational therapist on that in Ontario, which is great. And persons with disabilities. So we are now getting more input. The code is shifting, and actually visitability is being incorporated into code in some provinces. So that's already happened. The space in the bathroom and having some of the backing behind the walls is going into code. So we are seeing some small changes happening. We know that there won't be it goes in cycles, but I just wanted people to know that code, it takes a long time to change, but that people are on this, and we've got accessibility committees now task groups involved with the code at the National Research Council level, which is really great. And so I'm optimistic about the code at the bottom changing. The standards are the shoulds. There's another standard called Accessible Ready Homes, and that's also a CSA and ASC collaboration. And so that one talks about how to set up a home so it can be adapted as somebody progresses or their life needs change. So let's end with some hope that things are going to change from a guidelines and policy perspective. And then the more education, the more workshops we do like this, the more awareness we can all be pushing for it. So thank you.
Thanks so much. It's as I say, it's a testament to the number of registrations we had and the number of people on this call, how important this issue is to get information out there and discuss. So thank you, Kaly, Dawn, Marnie, thank you so much for joining us today and joining me today. It's been a really great conversation. Thanks to all of you online. The conversation in the chat has been robust and there's been lots of questions. We will send out, there's a real desire for information and links, and we will make sure we've curated that from the chat as well. If you can stick around and do the evaluation, all of you who are attending, we would really appreciate that. But thank you, and have a great rest of your week. Thanks, everybody. Take care. Bye.